Separated from Malaysia in 1965 and dominated by one political party over most of its history, the government of Singapore has seen to focused, well-coordinated efforts by its various ministries in the establishment and implementation of national priorities in order of number 1, national security, number 2, housing, number 3, education, and the fourth, healthcare. Any discussion using an analytical framework regarding Singapore needs to recognize its unique environmental position, 1 degree north of the equator, not prone to earthquakes or typhoons, but with year-round high rainfall, humidity, and abundant mosquitoes. From the country's early inception, when typhoid, malaria, and cholera thrived, to present-day dengue, SARS, and chikungunya, this country, unlike any of the other industrialized countries, has been on the forefront of the battle against traditional and emerging communicable diseases. Early weakness led to the realization that infrastructure was crucial as hospitals and outpatient clinics quickly arose. Legislation such as the Infectious Disease Act of 1976 reestablished quarantine laws of the early 1900s, and coupled with technologies such as web-based home quarantine monitoring and healthcare worker microchip tracking, made the country a role model in dealing with SARS in 2003.
The population in Singapore has steadily increased from about 3 million in 1990 to 5.4 million in 2014. In 2012, the World Health Organization ranked Singapore number 1 in terms of its lowest infant mortality rate, 2 in terms of the maternal mortality rate, and number 9 in terms of its life expectancy at birth. About 74% of the total population is between the ages of 15 and 64. The total fertility rate is 1.19 children per woman, which is significantly below the replacement level. In terms of its ethnic distribution, the majority is Chinese descendant, followed by Malay and Indian. About 3.3% of the population are immigrants from other countries such as the Philippines and Thailand. At the current population growth rate, by 2030, 20% of the total population will be aged 65 or older. The main causes of death in the country are cancer and cardiovascular disease, and the main risk factors are associated with lifestyle and the related behaviors such as dietary intake and low physical activity.
Innovations in combating the epidemiological and demographic hurdles to development came together during the 1970s and ushered in a demographic transition and an extended period of economic growth. We've heard of the famous Asian tigers, and Singapore was one of the famous 4 that went from underdeveloped to rich country status in a generation. You can see the drastic rise in GDP and investments in healthcare here, but what is important to note is that without this level of growth, Singapore would not be the success story that we will discuss today. Currently investing only 13.8% of government expenditure in health, projections show that there is considerable space for additional investments, all made possible by a robust and stable government and political infrastructure.
The Singapore government is a centralized, efficient, top-down system headed by Tony Tan, the 7th president, who appoints the leaders of the 3 branches listed below. The Prime Minister is Mr. Lee Hsien Loong, also pictured. Members of Parliament appoint the cabinet members under the advisorship of the President and the Prime Minister. The cabinet is the central decision-making body of the executive government, responsible for the general direction of the government and accountable to Parliament. Within the cabinet, the 2011 appointed Minister of Health is Mr. Gan Kim Young, pictured below. The ministers work together in an efficient system, advising each other in a collaborative environment, a major strength of the Singapore government system. In terms of the legal and regulatory context related to the Singapore health system, the government has passed 20 acts under the purview of the Ministry of Health. These acts regulate public health and safety and concern issues such as medical practice, patient safety, and biosafety. The statutory boards within the regulator branch are charged with upholding these responsibilities. The Singapore health system operates under the premise that improving quality is a never-ending journey. The Minister of Health collaborates closely with the Permanent Secretary of Health, Mrs. Tan Cheng Yi. To address specific improvements that need to be made, the Ministry of Health holds annual national healthcare quality improvement poster competitions, demonstrating their drive for continued improvement. Singapore's healthcare regulatory framework consists of a regulator and a regulated branch. Regulators include the Ministry of Health and dozens of statutory boards, including the main regulator powers, the Health Promotion Board and the Health Sciences Authority. Regulated members include all public and private providers, including all healthcare professionals. These healthcare professionals are self-regulated, a potential weakness of the system, yet they report to the most relevant of 7 established councils, also known as professional bodies. Now we will discuss the goals of Singapore's healthcare system, in which there are 3 pillars: access to preventative healthcare, personal responsibility, and manageable healthcare costs.
Access metrics such as physician-to-population ratios in Singapore at 1.6 per thousand population are midway between countries like Bangladesh midway between countries like Bangladesh at 0.3 physicians per thousand and the US at 2.5 per thousand. In regards to hospital beds, Singapore stands close to the US at 2.9 per thousand. While such capacity can be seen as a strength, recent trends in aging have stressed the system, and new physicians are being recruited and new beds added.
Now, Singapore's public health financing system is based on an ethos of personal responsibility. As you can see, all costs begin with the individual, and the 3 M's are the main mechanism through which citizens enter the health system. Nothing is truly free in the Singapore system, and the first M, MediSave, was the first medical savings program set up in the world and is a mandatory contribution scheme intended for individuals to understand and feel the real costs of good health. MediShield is a low-cost basic medical insurance scheme to help members meet hospitalization bills, which could not be sufficiently covered by their MediSave balances. As you can see, savings is a huge component of the Singaporean system. MediFund acts as a safety net for those who cannot afford the subsidized bill charges, despite the access to MediSave and MediShield coverage. And yet, through all of these mechanisms, medical care at and in public facilities is still heavily subsidized, imposed to help keep costs to a minimum. Given the demographic profile of the country, this system is both complex enough in its funding methods and flexible enough in its structure, as illustrated by the establishment of ElderShield for individuals over 65, which has even been modified to adjust with its changing demographic needs and, of course, the rising costs. There are a number of ways that the Singaporean government intervenes in the market to keep costs down, but we have only highlighted 5 here. Without going into the text of this text-heavy slide, the general framework of this pillar and one major success of the Singapore system is to strategically intervene, as in rationing the number of doctors in each sector to keep human resource costs low, or through investments in research and development. While a theoretically sound rationale for intervention, we need to ask, how successful and effective are these mechanisms at managing health costs?
Effectiveness by standard metrics as illustrated would place Singapore in what best can be described as a high-functioning healthcare system, with qualities such as low infant mortality, increased longevity, high patient satisfaction coupled with low overall cost.
Now, remember that Pillars 2 and 3 and the objectives of the system are not concerned with keeping public costs to a minimum, as in the government's share of the burden to a minimum, but rather to keep health care costs low generally. Looking at this data, would you say that Singapore is succeeding? As we heard in our effectiveness discussion, Singapore spends less on healthcare than any other industrialized country. But there's a real threat here, based on historical trends, that this could change in as few as 5 years if costs are not controlled. Even so, the Singapore system is built on 3 pillars that enshrine choice and ensure equity. While citizens do not have a choice to save, it is in saving that Singaporeans are able to take full advantage of the government's resources and choose the best care per person. This is facilitated by price transparency and comparisons, and is probably the area where Singapore could translate lessons learned into better cost savings and improve efficiency in the system.
As we have seen through this analysis, the country faces many challenges, and from this we have highlighted 3. The increase in chronic conditions, the emerging infectious diseases such as the dengue paradox, and the global warming with rising water sea levels and other negative impact in the ecosystem. In addition, the projected increase in aging population will require increased investments and expansion of multi-sectoral interventions to keep older populations healthier through wellness programs such as the one that they're currently implementing, which is a strength of the system. Along with this, there are concerns about rising healthcare costs, which require additional strategies to keep prices down. Last but not least are the political changes that can bring opportunities to increase citizen participation through the democratic processes, but also challenges in terms of reaching consensus on short and long-term strategies to strengthen the health system and also support economic growth in an equitable manner.